For elbow range of motion, we are going to have the patient in a supine position. We are going to have him in 0 degrees of flexion, extension, and abduction. We're also going to have him in a supinated position. The towel and the table are preventing shoulder extension. And next we will do goniometry. The goniometer is going to have the fulcrum on the lateral epicondyle with a stationary arm on the humeral shaft, and then the moving arm is going to be along the radial shaft. And as you can see, are you as far as you can go?
As far as I can go.
You are in 12 degrees of flexion, so he is outside of the normal extension, which is 0. For flexion, we are going to take him through, for active range of motion, we are going to have him flex his elbow all the way toward his chest, and then keeping the fulcrum as close to the lateral epicondyle, we are going to measure, and he is at 142, which is within the normal value of 150 for flexion. For infeel and elbow, you're going to have hard contact because of the bony contact and extension, and in flexion, you're going to have soft infeel because of the approximation of the musculature. As a PT, I'm going to be positioning myself at the level of the goniometer and the joint that is in question. I'm going to probably be kneeling beside him and or squatting.
For manual muscle testing of the triceps, the patient is going to begin in a prone position with his head rotated in the opposite direction of the extremity which we are testing today. To begin testing the tricep, we are going to have the arm abducted at 90 degrees with the elbow extended just less than full extension with the forearm supported from the table. I'm then going to apply gradual pressure at the distal forearm in the direction of flexion. Can you hold this position here for me, Alex?
Yes, I can.
Wonderful. All right, don't let me move you. Hold, 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 relax.
What score would you give him?
I would give Alex a score of a 4+. You instantly gets a 3 because he can hold the test position. I applied moderate pressure and it was difficult to move him, so that's why I give him a 4+. For manual muscle testing of the biceps brachii, the patient is going to be in seated position. We're going to put a towel in between his forearm and his trunk to ensure that there is no abduction as a compensation. I'm going to stabilize at the elbow and I'm going to apply a gradual force at the distal forearm. Wonderful. Don't let me move you. Hold, 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 relax. That would be a score of 5 because I was applying very firm pressure and was unable to break that position. For the triceps, manual muscle testing is very important for the physical therapist to be aware of their body positioning. So in the case of the triceps, you want to make sure that you are at the level of the joint in question. So for me, I was kneeling. Squatting would also be acceptable, making sure that the line of force is perpendicular to the floor. That same line of force will be carried over with the biceps brachii. However, standing position is adequate here since it doesn't involve extensive flexion.
Okay, so we're going to be examining the muscle length of your triceps today, and in this position the patient is going to be supine, scooted over towards the edge just to ensure that we can get the full range of motion for the triceps. Alright, now we're going to be assessing the triceps muscle length, and so now that the patient's in supine, first we have to examine the active range of motion and then the passively, and if there is any deviations from normal, we'll go ahead and assess the muscle length. Good. So first we're going to make sure the patient is in a neutral position, and we're going to fully flex the glenohumeral joint, and then we are going to bend the elbow into flexion, and from there we are going to align the goniometer. So like the flexion of the elbow, we are going to place the goniometer, the fulcrum, at the lateral epicondyle, the stable arm down the mid shaft of the humerus, and the movement arm along the radius down to the radial styloid process. Okay, to assess the muscle length of the triceps, we're comparing the flexion here to that of the elbow flexion, and her reading is right 145, and so we'll compare that to the normal range of biceps flexion, which is about 150, so it's within normal limits. For the therapist position, when assessing the muscle length of the triceps, you want to be adjacent to the joint of interest and kneeling down so you can put the joint at eye level.
And that completes an elbow exam.